Welcome. I'm Andy Garcia. Life can be daunting for those who attempt to navigate it alone. Fortunately, there are resources and support systems that are available to provide new pathways for individuals looking for solutions to improve their lives.
Mental health is an issue that faces all age groups. But for our children, it has become a crisis. Suicide has become the #2 cause of death for children, and the number of children affected by mental health problems grows every year.
So mental health crisis is really a complex issue full of various factors. One of those factors would be social media and cyberbullying. When kids spend the amount of time on social media platforms, it can create a lot of anxiety, depression, because they're looking at unrealistic standards of what people look like and how you should behave. Add to that cyberbullying that really has become a major problem for many people.
The daily experience of children with mental health problems is quite varied. There are so many different health challenges I think that our kids have today. I know in my own family, moods can be mercurial, responses to any types of change in schedule. Life does throw things at us, and that can really upset the apple cart of a family in the morning and throughout the day of a child who struggles with mental health issues.
Mental health organizations are creating programs specifically designed to combat this epidemic affecting our children. We must change our attitude towards mental health for meaningful change to be made.
Trauma in early adulthood or early childhood is at the basis of a lot of the conditions that we treat, especially when it comes to anxiety disorders, post-traumatic stress disorders, depression, because these disorders from a very early age rob people of adrenaline, which is sort of the juice that keeps us moving and keeps us defending ourselves. Basically, these conditions can lead to overactive adrenaline, overactive vigilance, and can lead to a lot of other different things that we treat here.
I think it's important to know that with the rise in children's mental health challenges across our country and here in our community, that we need to address that preventatively. So one of the things that David Lawrence Centers is doing is we're working in the community to raise awareness and decrease stigma and try to help the community better understand what are the signs and the symptoms so that we can get early identification of these issues and then early intervention, because we know that makes a big difference in the short and the long-term prognosis and treatment.
For anyone with a child affected by any mental health problems, there is help out there. With the growing support of these programs, we might be able to curb this epidemic and make the future safe for our children.
As healthcare continues to improve, those improvements will be highlighted here. I'm Andy Garcia. See you next time.